Family pillar, you can't sleep like this. No, you cannot. You have to do something. So as the diagram is illustrating here, it is showing the types of hair that someone is likely to develop. So before we even talk about the types of hernia, we can describe what hernia is. So hernia is the protrusion or bulging of the internal organ or a tissue through the weak abdominal wall muscles. So if the abdomen is made up of different muscles, such as the linea semilunaris muscles, such as the rectus abdominis muscles, so they are just different. So if by any mistake these muscles becomes very weak, you'd find that organs, the internal organs such as the intestines, the stomach, start protruding to the outside environment. That is what we call hernia. Now, according to the diagram, it has illustrated certain types of hernia. Number one, have epigastric hernia. So the word epi means above. Then it's gastric, that means stomach. So when we say epigastric, we mean an area that is above the stomach. So if in that area there is a protrusion of internal organ, it being maybe a stomach or an esophagus or any organ, as long as it protrudes itself from that area, we'll call it epigastric hernia. Then you have umbilical hernia. Umbilical hernia, the word umbilical from the umbilical area. So if any internal organs protrudes from that area, that is what we call umbilical hernia. That is what we call umbilical hernia. Apart from that, we have Springerian hernia. So Springerian hernia, we are looking at hernia that protrudes from the Springerian area. So you have to understand the Springerian. The Springerian, it is coming from the word which is Springerian aponeurosis. So the Springerian aponeurosis, this is an area that is made up of connective tissue. Especially it is located in the anterior lateral walls of the abdomen between the linea semilunaris muscles as well as the rectus abdominis muscles. So between these two muscles, we will find that there is this Springerian aponeurosis. So if that area which is made up of connective tissues is weak, then internal organs will protrude from the same area. That is what we call Springerian hernia. Then we have incision hernia. That is as a result, for example, if a patient underwent surgery, then from the incision that they made, internal organs start protruding from the same incision that they made. That is what we call incisional hernia. So this is applicable to those who underwent surgery before. And this can happen in a way, for example, if someone has not attained full recovery, then they indulge in activities, for example, of lifting heavy things such as metal lifters, then eventually internal organs starts protruding from the same area uh, where they made an incision. That will be called incision hernia. Then we also have inguinal hernia from the inguinal region. We have the drainage which we call inguinal drainage, which provides for the inguinal the lymphatic system where the inguinal nodes, inguinal vessels pass through. That area is also delicate. Organs, they can protrude from that area, and we call it inguinal hernia. Then we also have femoral hernia. Remember, you have to understand the anatomy that we have the drainage, which is the femoral drainage, which consists of nerves, bundles. It has the blood vessels drainage and other things. Then from the same drainage, if there is descending of intestines or any other internal organs, when they descend, especially intestines, when they descend to that drainage, and be able to protrude from the outside area, especially of the femoral area. That is what we call femoral hernia. Now, they are not the least. We also have certain types, such as hiatus hernia. Hiatus hernia, mostly this one, it is congenital, where someone can born with the big hilus. So hiatus hernia, it is coming from the word hilus. Hilus is the hole that provides the entry of the esophagus through the diaphragm muscle. Now that area, if it becomes very big, and when it be able to allow the esophagus and the stomach to move upward through that hole, which is called the hilus in the diaphragm. That is what we call hiatus hernia. We also have a certain hernia which is called a scrotal hernia. Scrotal hernia is when the intestines are able to descend to go inside the scrotum. That is what we call scrotal hernia. Now you have to also to understand that in summary, there are classification of hernias. We have complicated as well as uncomplicated. Uncomplicated, it is not an emergency. Someone can wait. You can wait even for months to go for surgery. Complicated is the one that we call strangulated hernia. Meaning, for example, when we say strangulated hernia, an organ protrudes from the outside environment and it is twisted in the sense that the blood supply to that protruded organ or protruded tissue, the blood has failed to reach that area. Meaning, that area cells will start dying. If it is an intestine, the protruded intestine, if it is twisted, it becomes strangulated, meaning that area will start dying bit by bit because cells will not be supplied with nutrients as well as oxygen. So that is what we call strangulated hernia, and that it is an emergency because it has interrupted the blood supply to that specific area. It should be dealt with as an emergency surgery. Thank you for your time. For more, reach me out.